Ever wondered why some patients in cardiac arrest respond fast to epinephrine, while others don't make it despite textbook resuscitation? Welcome to the gray zone of emergency medicine, where decisions are fast, stakes are high, and you only get one shot. Emergency Medicine, Board Review PDF isn't just another study guide. It's the distillation of what actually shows up on the boards and what saves lives in real trauma bays. Let's break down what makes this resource a must-have for any med student, resident, or healthcare professional preparing for EM boards or even just surviving the ED. Inside, you'll get rapid-fire, high-yield summaries on airway management, shock, toxicology, trauma, and ACLS algorithms that are board-tested and clinically proven. For example, do you know the exact dose of atropine for bradycardia in a pediatric patient, or when not to intubate in a burn victim? This PDF gives you the fast answers without digging through 800 pages. Each chapter is formatted for recall under pressure because we know in emergency medicine you don't get time to look things up. It's visual, bulleted, and packed with mnemonics. Even better, the review is structured by body systems and includes key ECGs, X-rays, and clinical pearls that you'll wish you had known before that 3 a.m. code blue. So whether you're cramming for the boards, prepping for rotations, or just want to level up your EM game, this PDF is the shortcut to competence and confidence. Want the full version? Click the link in the description to grab your copy now. And hey, if this helped clarify even one emergency decision for you, hit that like button, subscribe for more clinical breakdowns, and don't forget to share it with a friend who's also grinding through med school. Stay sharp, stay ready. Lives depend on it.